Shifting focus now to COVID, cases in Maharashtra's Mumbai are increasing at a staggering pace. One of the reasons for the surge, experts say, could be that we're already in festival mode. Today being Ganesh Chaturthi, people came out in large numbers to shop for the festival. In fact, this entire week, the Mumbai streets have been jam-packed. And there is absolutely no way that anybody is really thinking about following the COVID norms of any kind. Now, however, this is not to say that Maharashtra or Mumbai is the only place where we're seeing this kind of crowding, but it is a very big festival here, and people are coming out in large numbers, and that is reflective in the number of cases already. In the last 10 days, almost every single day in Mumbai, we've actually seen over 400 cases. So September 2 to September 8, 434 cases was the average. The week before that, it was 367 cases as an average. The week before that, 287 cases. We've had a long, low case, peaceful time for a really long time. And now they're beginning to actually shoot up significantly. This conversation is only to remind people that COVID still exists, even if you're vaccinated, even if you've had the infection in the past, you may still get infected again. You may still be a carrier of COVID who then passes on to other people. If we are not alert enough, we may be staring then at a possible third wave. Oh, that's my sense. Maybe the experts have something different to say about it. I don't know. There's also the whole argument that now a larger percentage of people are vaccinated. Many others have antibodies in them because they've already been infected in the first wave or in the second wave. The second wave was disastrous for most parts of the country. So unlike Kerala, where the seroprevalence was very low, that's not the case for states like Maharashtra. So maybe it isn't such a big challenge. But do we want to take that risk? Let's say good evening to Dr. Ishwar Gilara, infectious disease expert, joining me this evening. Dr. Rajiv Dasgupta, chairperson for the Center for Social Medicine and Community Health at JNU, member of the National COVID Task Force. Dr. Shashank Joshi, joining me this evening, member of the Maharashtra COVID-19 Task Force as well. Let me actually start off with Dr. Rajiv Dasgupta, because Dr. Dasgupta has actually been a very regular panelist on our conversations about breaching COVID norms, overcrowding, whether it's up north, down south, or now in the west. And Mr. Dasgupta, is this okay, or are we now teasing the virus?
Thank you. You mentioned north, south, and west. I'm actually speaking to you from the east today. I'm in Kolkata, which is gearing up for Durga Puja, which Bengalis like to believe is the mother of all festivities. A public health professional I spoke to last week in Calcutta was of the opinion that the pujas this time is going to be celebrated with a vengeance. What she probably meant was that there's a lot of pent-up emotions, and that's true for all the festivities at this time, including Ganesh Chaturthi, as we are witnessing. On the other hand, today, in one of the neighborhood pujas, I saw a very poignant message, and that I think is the core of the issue. That this time, and the message says that this time in 2021, it is going to be worship and not festivity. And worship, as the dictionary meaning goes, is the feeling of expression of reverence and adoration for a deity. So the message is that let's distinguish between worship and festivity. But is it too much to ask of an Aam Aadmi? That itself is the communication challenge that we should gear up to.
Okay, well, you know, the fact that you are in the heart of the place where the festivities are also going to begin shortly at the same scale that we see Ganpati here, it will be Durga Puja there. It will be very interesting to see how both of these areas react and respond. I don't think people are in the mood, but it is our responsibility to keep reminding them that some amount of precautions have to be taken. Dr. Shashank Joshi, good evening to you. Bombay has had several challenging months We actually desperately waited for the time when the cases would come down to below 500 on a daily basis, and then there were several weeks of that taking place. We are now inching up again. What's your sense of where we are headed this festival period?
So clearly there is a red alert, and festivities are spreader events. We all know that. So there is no two ways about it that people need to behave responsibly, and there is no question asked about that. We have to double mask, we have to avoid crowds, and we need to be responsible. Behavior is a mandatory thing. Having said that, Mumbai is currently having a TPR of 0.5%, which has gone up to around 1, and it's hovering around 1%. The primary reason from those 200 going up to 400 or 500 is that they have adopted a new strategy, which is society by society. They are doing clustering. And if 4 or 5 people come positive from a particular society, they are completely sealing of the society. And after 5 days, they are actually screening each and every person living in that society, and the testing is done. The testing numbers are also up, almost around 40 to 50,000 testing is done. But the test positivity rate is persistent around 1%. So there is a clear cut spike. And if you see the RT-PCR test positivity rate, it is between 1.5 to 2%. Two things we have to factor in. Number one is that if you see the national survey of antibody prevalence, zero survey, 2/3 of India is already having some degree of antibodies. And second, if you see the vaccination percentage, it has gone up with even double vaccines. So with that in mind, if there is no new variant of concern and there's a reasonable exposure to Delta, and if we don't get a new variant of concern, variant of interest, we are unlikely to have a major third wave. But the only challenge is if we have reckless behavior like the pictorials which you are showing, and people do not behave appropriately, behave recklessly, then it is like a doomsday or it could spell a disaster. Having said that, I personally feel that we need to keep the mask fines up. They are too low in Mumbai, I feel. If you just walk across to Gujarat, if you don't wear a mask, the fine is up to 2,000 rupees. In Mumbai, the fine is only 200 rupees. So people are a little lax and casual in terms of masking. And we know that this is an airborne droplet virus. So we need to mandatorily mask. Masking is probably much more effective than any vaccination. And that's something which people need to do. We are not saying don't do festivals. Our enemy is neither the festivals, nor the congregations, nor God or religion. But it is fundamentally the COVID virus. And when we have a common enemy in COVID virus, we need to be cautious and careful. And we should not allow the COVID virus to enter our body. And that is why masking and behaving appropriately is mandatory. And I don't think people, public memory is very short. People have suddenly forgotten the month of April when that explosive second wave hit us. Everybody is tired, everybody's got COVID fatigue, but I still feel that another 3 months or 4 months, we still need responsible behavior from citizens at large.
Another 3 months to 4 months, we still need responsible behavior from citizens at large. Dr. Ishwar Gilada, citizens actually for the longest time now haven't really shown that kind of a restraint. I think the first 6-8 months, after that, there was much saturation. People were tired. They just wanted to get out. They just wanted to socialize or meet people or at least, be out. And we've seen that we've struggled to ensuring that COVID norms are maintained. Does the onus then lie on authorities, or do we continue to just hope that people see, some better sense in this?
See, Tanvi, onus lies on three things. One is policies. Policies depends on the governments. Second thing is on people. And third thing is on percentage of vaccination. If you look at policies, there's a clear dichotomy. The health minister of Maharashtra says that behave properly, have COVID appropriate behavior. The transport minister says that you remove all restrictions of travel for Konkan. You remove even toll tax. No toll should be charged. Road should be made nice. Put ambulances. That means you are making arrangements for people to go to Konkan. They have started 2,000 special buses, 64 Western Railway trains, 120 Central Railway trains. So on one hand, you are facilitating the spread of corona, and then you behave as if that we are telling people are not listening. Percentage of vaccination in Maharashtra, what they talk in number is Maharashtra is number 2, UP is number 1 because of population. If you talk per lakh percent of population, per lakh or per million, then Maharashtra is 28th in number in first dose and 21st in number in complete vaccination. So Maharashtra is very bad. The reason may be anything. Any kind of such pandemic, you bring politics and you bring religion, you spoil the whole thing. You remove politics and religion, things are very well maintained. So Maharashtra has to, barring Pune and Mumbai, vaccination in entire Maharashtra is very poor. Maybe one or two districts are better. And very poor means they are half of Mumbai's vaccination. So if we don't do that kind of vaccination, if we talk about country, then we have to do 112 crore vaccination in 112 days. Only 112 is remaining for 31st December. And we have only done 72 crore vaccination. However, there are more and more vaccines being made available. More and more new companies are coming in. Even Covaxin facilities in Gujarat is going to roll out. So I think we are fairly good. But as you said,
So, Dr. Gilada, let me ask you this, because yes, everybody, is just watching out for how much we are able to vaccinate, and everybody is hoping in the next 3 to 4 months situation improves only because a larger percentage of people will be vaccinated. You say outside of Mumbai and Pune, the situation percentage of vaccination is not that high. Agreed, but is that the state's fault? Because at the end of the day, the supply is really coming from the center. The policy is being decided by the center. Are you suggesting that we relook at the policy of distribution then within the state?
It may be that center-state relationship, but if you look at Kerala, Kerala has done very good vaccination. So Kerala is also opposition state to center. So I think there is something inherently wrong in pushing the vaccination properly. And secondly, what you do, Sundays there is no vaccination. On Monday there is a vaccination. If you see Sunday and Monday difference is 10 lakh and 1 crore in the country. So there has to be some consistency. We are 8 months into vaccination, 9 months into vaccination. We should have a weekly program that we have so much vaccine available and it will be per day distributed like this. It cannot be that people go to vaccination center, aaj vaccine uplabdh nahi hai. So that kind of hesitancy, when you talk about vaccine hesitancy, there is absolute hesitancy. People may not take vaccine at all. But there's a partial hesitancy where people don't want to lose their daily livelihood to go to vaccination center and come back empty-handed. So we need to have some kind of consistency there, and there we are lacking somewhere. So whether it's the center or state, it's the people's problem. So we need to solve this problem and we need to plug these holes.
Okay. Dr. Shashank Joshi, do you think there is merit into relooking at the policy? Maybe a lot of available vaccine in the two cities that have seen significant vaccination being moved to other places?
A couple of things. Definitely, we need to vaccinate most of the people in most of the places. And it should not be concentrated on 4 or 5 geographies. That is number one. Number two, that we need to be very clear about our supply chain. And at least we should get a weekly likelihood of what is going to come where. So as Dr. Gilada said, that we need to have that, if that is there in advance. And now, of course, BMC puts out a notice, but it puts out a notice on the previous night, so that next day morning we know who is going to get the vaccine or not. So people can do a little better planning on it. So that is, I think, something which is very correctable. The third thing is that the vaccine hesitancy, which was there earlier in rural Maharashtra, particularly in the months of April and May, has come down substantially, but still a lot needs to be done. So I think it is important that as much as we are vaccinating urban metros like Mumbai and Pune, or Nagpur and Nashik, or Aurangabad, we equally need to vaccinate the last village and the last mile. And we need to ensure that we vaccinate Maharashtra. Maharashtra is doing reasonably well. Dr. Gilada has his own way of looking at statistics. But overall, if you ask me, they have done well. But of course, our hands are tied up. And India in general also has done well. We could have done better, but it is directly proportional to the supply chain. I personally feel that in the next 3 months, if we have another 3 vaccine manufacturers coming out with their vaccines, we will have a larger supply of vaccines. But what is happening is one day we do 1 crore plus, the next 2 days there is a lull and it comes down to again 50, 60, 70 lakhs. Then again we go to 1 crore. If we are able to do a little more consistency in the supply, which I'm certain that it will happen, we also have a Pune plant of Covaxin about to start its manufacturing somewhere in another 3 weeks from now. We have Hafkin in November to start Covaxin manufacture. So if we are going to get more and more vaccines coming out in the next 3 to 4 months, I feel this situation will improve. It is already better than what it was before. But till that time, as I said, for 3 to 4 months, we still need to follow strict behavior. And the strongest vaccine even now today is double mask, whether you like it or not.
Okay, let me just very quickly also briefly touch upon a larger national picture, and Dr. Rajiv Das Gupta, because for now many weeks really the India's numbers have largely been about Kerala. 50%, 60% of the daily cases are coming in from Kerala. Then of course the other state is Maharashtra and a couple of others. Now, strangely, as Kerala begins to taper down, so is the nationwide number. Is there a possibility that we misread the situation in festival time? We think that, oh, the numbers nationally are coming down, so everything is okay, but on ground, the reality is different?
Well, the on-ground reality is reflected by a post-Delta situation, which is in contrast to the rest of the world, which is now going through the Delta surge, almost every country in the world, I mean, that's a tsunami that's passed through India. Plus, of course, the vaccination certainly picking up a lot of momentum. So a combination of these two means that the pool of susceptibles or vulnerables are relatively low in most states, but that's not true of states which had low seroprevalence, relatively low that is, which is Kerala, which is almost all the northeastern states. And secondly, as we know that the extent of undercount has been the lowest in Kerala, which is actually the best, which means that for every case detected, they only missed 6, which in several states is in the range of 80 or even 100 plus. So states, and in fact, in Maharashtra, the seroprevalence has been relatively high, but the undercount has actually been pretty good, which means that Maharashtra actually diagnosed or missed much less cases for each one they diagnosed. So a combination of these two certainly mean that it's Maharashtra and Kerala which have continued to contribute to the cases, and therefore I would really argue that it's really a continuation of the tail of the second wave in Kerala and Maharashtra rather than the seeds of a third wave. But the rest of the country, there would still be districts, which we have discussed many times, which still don't have district level seroprevalence, which is also not very easy to produce overnight. But there would be districts that are more vulnerable than the others, and those could still face greater difficulty in the festivity times.
Would you agree, Dr. Shashank Joshi, that this is probably the tail end of our second wave?
Absolutely. I mean, there is a thinning and thickening of the tail of the second wave. No two ways about it. And the third wave is far away. The third wave with this all hype which is being created is only to scare people so that they behave appropriately.
But that's also not working, Dr. Joshi, on ground, if you see.
Sorry?
I said, that's not working if you see on ground. I don't think people are scared of it right now. They've forgotten about it.
That is true. But as I said, we need to keep on doing what is correct, and we need to community participation. We need responsible behavior.
Right.
But 2/3 of India already has antibodies, and already there is a large population exposed to the Delta. And if there is no major new variant of concern or interest, it is unlikely that the third wave will come before December or January, unless and until we do something seriously wrong. And I think such reckless behavior sometimes may lead to some spurts. And that is true. Other problem is that after a single vaccine or a double vaccine also, people need to continue masking. And that is something which is not happening. But I agree with doctor that we are still now seeing the fag end of the second wave. And unfortunately, because of these incidents, the second wave's tail from Kerala, Maharashtra, Northeast states has just not gone. The other state of concern for me across India is Bengal. Bengal in RT-PCR is showing a test positivity rate of almost 6%, though overall their test positivity rate may be 2 or 3%. But we don't know what's happening there, and that's another state of concern which may emerge. Rest of India is more or less out of the second wave completely.
Okay.
Karnataka, Tamil Nadu, and Andhra Pradesh still, they are neighboring states of Kerala, are showing some numbers which are not to our liking. But overall, Kerala is dominating India picture, followed by Maharashtra.
Okay. Dr. Glada, my last question to you before I wrap. What's the reason that, earlier we were being told that perhaps the third wave will hit us by September or peak in October? There were some mathematical projections also to suggest the same. But now it could come much later. Firstly, do you agree it will come much, much later? And then is it simply because a lot of it was being said to create an atmosphere of fear in minds of people?
See, 18 months into the pandemic, nobody is expert in corona. And much less those kind of statistician, Sutra model or National Projection Council. They have misguided the country earlier. They're saying that second wave will not come, and we have seen what kind of second wave is there. But at the same time, we cannot only scare the people. We have to make them partners in our movement. Otherwise, they will develop a vengeance. And I just coined a slogan based on Ganpati. कीजिए गणपति की जरूर आरती पर मत बनाना कोरोना को अपना सारथी. So basically you can worship the god, we can make the distance. I'm also reminded of HIV days. There was one Vicky from Australia who said that one person was sleeping 1% extra, and they said that if you are sleeping with 1% extra, that means you are sleeping all the person, that person was sleeping directly or indirectly. So same thing, if you are coming in 1% extra without mask in contact, then you are exposing so many people that person had come into contact. And therefore, even if we have a very good vaccination, still Delta wave, Delta variant saves only 60% people, so 40% less. And even currently eligible people are only 60% population.
Right.
So 60% into 60%, 100% also we cover. It will be just 35, 40%, and then some naturally infected people. So we are far away from that kind of natural or herd immunity.
Okay.
So we need to
we are far away from that kind of a herd immunity, despite the fact that many have been vaccinated or may have been infected in the past. Experts are still unanimously telling all of us to continue following COVID norms, to continue wearing double mask, maintaining distance. And here's a reminder one more time. This kind of festival crowding is not okay. Even if there's a possibility that the third wave comes later, that the next round of big cases comes later, we are unnecessarily inviting trouble by creating these kind of situations. I hope people listen. Thank you so much for joining us on this conversation.